Right.
Ready when you are, Minister.
Wonderful. Well, good afternoon, Queensland. I know many of you have already tuned in to hear the Premier talk about the weather events. So I will be giving the COVID update today. In doing so, can I start by just acknowledging that we've had one new death reported overnight and an additional death that has now been confirmed as a COVID case. So our numbers will be reported as 10 people who have lost their lives as a consequence of COVID. So can I just pass on my condolences to the family and friends of those two individuals, and the Chief Health Officer will talk in a little bit more detail about those two. We have 11,174 reported new cases overnight, bringing us to 62,920 active cases. 3 new local government areas, and I think I did a rough tally this morning that there's only about 14 local government areas that haven't had a positive case now since we opened up at the 80% mark, and the new LGAs are Baloo, Mapoon and Winton. We've done 33,119 tests in the last 24 hours, so again we're showing 1 in 3 people who have had a PCR test in the last 24 hours is showing up positive. So it shows you the rate of infection that is spreading in the community, and we know that there's many more people out there who have done a rapid antigen test or hasn't come forward for a test at all at this stage. We've got 17 people in ICU, 3 on ventilators, and 349 people who are positive COVID patients being cared for in our hospital, in addition to the 17 in ICU. We have over 24,000 being cared for at home as part of our care at home program, and our vaccination rates are now 91.02% first dose. So can I congratulate Queenslanders for continuing to come out and get vaccinated, and we are at 87.46% double dose. So we are creeping slowly towards that 90% double dose rate, and of course we've had over 203,379 people coming out and getting boosters, and I'm here at the Brighton Vaccination Clinic here today, and I know people are just streaming in and getting their boosters, and I just want to thank the staff here. I'm here actually delivering a really positive message to the staff. There was a lovely post on the Sandgate Mums Facebook yesterday just praising the staff here and helping an elderly aunt who couldn't get in to a pharmacy or GP for 6 weeks, and they came here and they were immediately looked after. So I can't wait to go in and pass on that message to the staff here. As far as our new positive rapid antigen test individuals out there, we have just gone live with our new register. So you can go online to the Queensland Government website, to the COVID website, and on the front page you will find a link for positive people who have taken a rapid antigen test at home. Click on that link. It is really simple to register that you have tested positive, and we are asking anyone who has tested positive in the last 14 days to go on to that register and report. And of course, going forward, if you get a positive test, please go online and register that. If you can't access online, you can ring the 134 COVID line, and you will be able to be redirected to register that you have had a positive test at home. So you can do it by phone or you can do it online, and that has gone live now at 12 o'clock today. So I suspect we're going to see many more numbers tomorrow and beyond. We've seen what's happened in Victoria with over 50,000 cases reported. I understand around half of those cases are people reporting that they had a rapid antigen test at home. So please jump online, report it. That will help us with our modelling, but most importantly, it helps us support you at home while you go through dealing with COVID. So you'll be, if you go online, you'll get an email and information from the Chief Health Officer that will advise you what steps to take now that you are positive. I also want to advise that from today we are initiating a statewide suspension of non-urgent elective surgery. So that is category 3 and some category 2 surgery. Many of the hospital and health services have already initiated this at a local level over the past few days, but now we are initiating this as a statewide initiative for our public hospitals, and this will continue until the 1st of March. Now, we will review this at the end of January to see where we are in the surge and where we expect the peak to occur. And hopefully we can bring that forward, but at this stage we'll be suspending these non-urgent elective surgery until the 1st of March. In relation to outpatients, we'll also be looking at either postponing or delivering telehealth for all non-urgent outpatient appointments. This will allow us to redirect our staff to where we need to deal with emergencies and COVID patients. This is part of the plan that we set out and we've been working on for months, where our tiered stages, we will move through these stages as we get more numbers. But also, it's not just about bed capacity, it's about health workers and their availability. So we have 3,505 health workers now, frontline health workers who are either positive or who themselves are quarantining. So this puts pressure on the health system, and that's why we have to put these plans into place. We will also be talking with the private hospitals to activate the contractual arrangements that we have put in place with the private sector to secure staffed beds over the coming days and weeks, so that we have those beds ready, that we can move public patients into the private hospital system to free up capacity so we can deal with those emergencies and deal with more COVID patients. We know this is going to cause anxiety for people having this surgery delayed. We had to do this in 2020. We are doing this as many other states are now doing as well. But it is important to make sure that our health workers are able to be focused on those emergencies and those COVID patients that need immediate care as well. I'll now hand over to the Chief Health Officer just to talk a bit more about these cases. Thank you.
Thank you very much, Minister. Sadly, I can report today the death of a man in his 30s from Brisbane who died unexpectedly at his home on January the 5th. The coroner has reported to us that the cause of his death was related to COVID-19. I can also, he was unvaccinated. I can also confirm that a man that I previously reported, a man in his 30s from the Gold Coast who died suddenly at his home, I think it was about 10 days ago. The coroner has confirmed that he also died of complications related to COVID-19. Now, deaths, our thoughts are with the families of both of these young men. I must emphasise that deaths in young people are rare, particularly unexpected deaths such as this are rare, but they are being reported both in Australia and other states and overseas. The most common cause of these sudden deaths in young people relate to infection by the virus of the heart, myocarditis, and that's the probable cause in both of these individuals. So this is a recognised complication of many different viral infections, including, for example, influenza. It is rare, but we are seeing increasing reports. And when you have a virus that is as widespread, when there are so many people infected with this virus, we are going to see reports of rare complications such as these. Myocarditis, that is viral infection of the heart, it can be very difficult for both the patient and for doctors to recognise before it causes sudden death. Symptoms can include pain behind the chest, and that's why we recommend people with significant chest pain, they seek medical advice if they have COVID-19. Sometimes you can experience breathlessness, sometimes fast or irregular heartbeat, or often it just comes out of the blue. I must emphasise it is exceedingly rare, but it has been reported both in Australia and overseas. Though that brings the total number of patients in Queensland, or people in Queensland who have died of COVID-19 since the beginning of the pandemic, to 10, and we've had three confirmed deaths in this recent wave since the opening on the 13th of December. On a more positive note, there are still just 17 patients in our hospital ICUs, despite the very large numbers of cases of COVID-19 right across Queensland, and still only 3 on ventilators, on life support, the same 3 that I reported yesterday. The number of cases in the general wards of the hospitals is creeping up gradually up to 349. That number is generally a manageable number. Our biggest issue in hospitals at the moment is the number of staff that are having either to quarantine because they're contacts or in isolation because they have the virus themselves. Most often staff are not catching the virus from patients, they're catching it in the community like the rest of us. Okay, so there are 24,508 patients receiving COVID care at home, and 33,119 tests were conducted yesterday. 91.02% of the 16 population has had at least 1 dose of the vaccine, and 87.46% has had two doses, which is fantastic news. I'll now hand back over to the Minister.
I just wanted to thank the Health Minister and the Chief Health Officer for coming here to Brighton. Those figures that both the Health Minister and the Chief Health Officer have mentioned in relation to our vaccination rates are very, very encouraging. And I know here in my electorate of Sandgate, here at the Brighton Health Campus, the vaccination clinic has been doing an outstanding job, doing some tremendous work, as highlighted by that example from the community that's been made mention of by the Health Minister. The staff here have done an outstanding power of work in providing and supporting first dose, second dose, and now boosters for a range of people in the community. I know when I came here in late December for my booster, it was a very simple process as a walk-up to be able to come along, get that service, get that support, and be able to go away better protected from the really challenging impacts that the virus now presents. So I just wanted to acknowledge and thank the Minister and the Chief Health Officer for coming here today, providing this further information, and also being here to be able to thank the great staff here at the Brighton Health Campus.
Minister, school seems to be still the big elephant in the room here. I mean, speaking just to in my circles, parents are extremely worried about homeschooling again. Is there an update you can provide, or is it still obviously being discussed between Cabinet?
So it's still being worked through with education and taking the advice of the Chief Health Officer. Obviously the Premier's been really clear in flagging that she doesn't want to see our primary school kids going back to school in the peak, and so we are considering delaying the start of the face-to-face schooling for, at the very least, the primary school, but there hasn't been any final decisions at this stage. And of course, National Cabinet are considering putting together a national framework as well, so we are keen on seeing what the other states are doing as well. But I know the Premier's got a Queensland Disaster Management Committee meeting tomorrow morning where there's a range of issues that we're going to be discussing, and I'm sure this will get discussed there as well.
So when will parents have a clear decision?
Look, the Premier's keen to get this information, this decision made very quickly, because we know school starts in 2 weeks for us and parents need certainty. So it's just a matter of days.
Is it
honestly.
high schools as well, Minister?
We're looking at both, whether it should apply to primary and secondary. But again, we're taking the advice of that. We know the disruption it causes to learning, but we also want to slow the spread and keep our kids and our teachers safe.
By the end of the week, we're going to get this today. What are those proposals?
Well, as I say, the Premier will announce very shortly what she wants to see happen here in Queensland. We do want a national framework, but ultimately we will do what we think is right for Queensland.
And on elective surgery, how many surgeries are being
Oh, look, I couldn't tell you the exact number because it will be all of Category 3, but some of Category 2. So the clinicians at the hospital and health service level will decide which of those Category 2s should still go ahead and which ones need to be suspended. But a lot of these people have already been contacted who had surgery scheduled in the next few days because they had been doing this at a local level.
Any idea on rough numbers? What would you think?
Oh, look, I can certainly get you some numbers, but I don't have that number at this stage. Look, irrespective of what the number is, this is what we have to do. It's always part of our staged plan, and as we've said, with cases surging throughout the community, our plan will mean that we will be redirecting services in our health system to manage. We've always said that, and this is certainly one of those stages. And with each HHS escalating to those higher levels, we need to do this as a statewide initiative to give certainty to patients, but to give certainty and clarity for the clinicians and the hospitals so they can get on with doing what they need to do, focusing on COVID right now.
How many private beds are you hoping to have access to?
So our clinicians are working on that at the moment. We're looking at what we may be asking for to come online in a week's time. So we may ask a certain number to come to be available in a week, and then more to come available the following week after that. So it'll probably escalate as we expect the numbers will escalate. So we won't walk in on day one and go, we want all of your beds secured. We'll gradually increase that. There are, there's, I think the figures I was given yesterday, about 5,000 to 6,000 private beds available over, I think, around 47 private facilities currently. Obviously, we're not looking at utilising all of those, but we do want to be able to shift patients from the public system to the private so we can free up beds.
A man in his 30s passing away is extremely concerning, considering that we hear so often that this is people get reluctant. They say this is a virus that only attacks older or more vulnerable people. I guess this is a prime example of why we should be out, obviously, being vaccinated. Obviously, it's awful for the family.
It is so sad, and there is something you can do to at least increase your protection, and that's vaccination. So please, we know our 20 to 39-year-olds are the lowest vaccination rate. We also know that this is the group that we are seeing the most virus in. So these are the people who are mobile in our community, going out, socialising a lot. You are likely to get it first, and you are likely to spread it to others. So that 20 to 39-year-old group, please don't think you're invincible. If you're not vaccinated, get vaccinated. If you're due for your second or your booster, please go get them as soon as you're eligible. But also, remember that it's not just about your health, it's also the loved ones around you, the young kids who aren't vaccinated yet, but also the elderly and the more vulnerable in our community. So, but sadly, this shows that healthy people can die from COVID, and we need to be very alert to the symptoms and finding out whether you've got it or not.
Was the man on the Gold Coast vaccinated or not?
I believe the gentleman on the Gold Coast was vaccinated, yes.
What care had the man in Brisbane been receiving? Was he part of a GP at home?
I don't believe so. We're still, this has only happened. We've only just found out about this death. As I understand it, this gentleman was found deceased in his home. So, and it's subsequent to that we're aware he has been tested positive. He was positive for COVID.
Minister, is there going to be a delay to, I know a couple of people that have sort of said they were going to get their kids vaccinated soon. Has there been a delay because they were told they had to cancel their booking due to Queensland Government? Their website had told them that they had to cancel the booking. There hasn't been any?
No, I got an update yesterday, in fact, and I can probably give you the numbers of that. In fact, on Wednesday we had 17,350 5 to 11-year-olds booked in at a state clinic. and as of yesterday, that's gone up to 23,159. So we are definitely seeing parents booking their kids in. We will accept walk-ins as well. I want to be a little bit careful about that though, because it's a bit like when we started early in the vaccination. The bookings will come first, and people who are lining up for walk-ins may potentially find themselves not being able to get vaccinated that day, but we are accepting walk-ins, and we'll monitor that very closely. But there are bookings available. I've told my team to have a look whether they can open more bookings, because we know that parents want to come out. I did the quick sums. 5% of all 5 to 11-year-olds in Queensland are already booked in at a state vaccination clinic to get vaccinated. So that's great news. Thank you, parents.
Has Queensland been impacted at all by the delayed delivery of the vaccine, specifically for 5 years and zero?
That is a very good question. The trucks were supposed to arrive yesterday. I will be getting an update today as to whether all of those deliveries have arrived at all of the vaccination centres that will be delivering the vaccine from Monday. So, pardon?
The Bruce Highway wouldn't have helped overnight?
No. So we can expect that there may be delays. If it looks like some of those centres that were going to be operating on Monday can't, we'll try to get that information updated through social media and online, but we really need to see how this weather pattern evolves over the next sort of 24 hours.
I'm hearing the paramedics starting to see a shortage in paramedics due to close contacts again, Minister. There's been reports on the Gold Coast that we've seen ambulances stood down overnight. What concern?
Look, I have no doubt. I haven't got an update on the paramedics numbers, but I have no doubt there's positive paramedics and there's paramedics that are close contacts as well. So, just as we're seeing with the police and the prisons and fire and emergency and every government agency as well as the private sector, and we're not unique. The private sector is really feeling it at the moment, and I see the empty shelves at our supermarkets. We know the disruption that COVID is causing right now. So, we ask for everyone's patience right now. We are doing what we can. We always knew this would happen. It's going to be hard. It's happening quicker, and it's happening at a far higher rate than any of the modelling showed. Remembering Omicron started only about 6 to 8 weeks ago globally. So we are managing this as best we can with the plans that we have in place. Sorry, last one.
For the minister, on the hotline, are you confident that people will actually
Look, I do think, and I think Victoria is a really good example of that. I think about 27,000 of the Victorian cases are people who tested at home that they've reported. So I have no doubt people who have tested positive in recent days will jump online, will ring that number, and will let us know. And, if you know of someone and you're watching this, give them a call, send them a text. Just say, this is live now, don't forget to register.
And do you expect that to make that data public?
Well, we'll be reporting every day what the what the testing numbers show. Yeah.
How does that test supply made it to all of the locations that are meant to go to? Because it hasn't happened.
Yeah, so again, because some of those were going out into the regions, that takes some time to get them, they were getting on planes and then trucked out to the HHSs and to the sites. So, there'll be some delays getting them out there, but they are being delivered at a number of sites. I think there's 8 or 9 sites here in southeast Queensland where we are handing out those tests. But I need to remind people they're going to run out soon until we get our next supply.
Dr. Gerard, just quickly, I'm going to get Hannah here in a second. I heard you obviously talking a little bit about complexities around these young people's deaths. Could we touch on it again? You're saying...
Well, the first thing I want to say is to getting the tone here right is very difficult. So when you have an epidemic which is involving very large numbers of people, particularly this age group, the 20 to 30-year-old age group, rare things, we will see rare things. We're going to see that. There'll be other rare things as well, and that's inevitable. The vast majority of people in their 20s and 30s who get this infection, if they're otherwise healthy and vaccinated, will have a mild illness. I think it is clear that the epidemic is widespread in the 20 to 30-year-old age group, and our numbers grossly underestimate the true number. I think I have two daughters in their 20s, and each of them probably has at least half a dozen friends who are known to be COVID positive, and I think anybody in their 20s or 30s would say the same thing. So our numbers grossly underestimate that. So we've got large numbers of people in this age group who are infected. So to get the tone right on this is quite difficult. These are rare events relative to how common COVID now is in Australia and Queensland. Yes.
On the clinics, I think Kelvin Grove and Indro closed at 1 today, but they'll meant to be open till 8.
I'm sorry, I don't know about that.
Dual lines for testing, is that happening?
Yeah, you think you missed something?
So as far as the dual lines, again, it's up to each clinic as to whether those lines will work for them as far as the volume of people, how many tests they've got, and which they're finding. So we've sort of said, look, you figure out what works for you. That's the quickest. And also, even with dual lines, making sure we're walking the lines and asking people if they fall into that category, because it's not just day 6. If we spot a vulnerable person in that line who we think, they could be self-testing at home and not waiting in a line for hours, then they're doing that as well. Look, we're looking at all those. What I can't do is pull health staff out of hospitals right now to do that. So, and the private sector is very well stretched over testing and vaccination as well. Plus, we're going to be using that private staff very shortly in the private hospitals. So, because when we secure the beds in the private hospitals, the agreement is they'll be providing the staff for that as well. So we won't need to utilise our own staff for that, which is going to be really critical.
So whether or not they're vax hubs does fully depend on how many people we can spare.
It is very much at the moment, yeah. So, but we have great vaccination hubs already set up and working really efficiently, like the one behind me. There is capacity there. So again, there's no reason for people to delay coming out and getting vaccinated if they're eligible. And we will be watching those booking slots and the walk-ins for the 5 to 11-year-olds. And I don't want to see a delay. So, but remembering pharmacies and GPs are also able to vaccinate children. So it's not just the state clinics, and we ask people to look at all those options. Thanks, everyone. Okay. Let's go say hello to these lovely. I will be giving the COVID update today in